Two people, same diagnosis but completely different treatments. One cannot survive without insulin, the other can manage for years with lifestyle changes. Why is it so? Well, most people don't know the actual difference between types 1 and 2 diabetes. Understanding these differences is a life-changing knowledge that can help you or help someone you care about to avoid serious complications. Welcome to Mira's Health Hub. Subscribe to my channel and let's begin immediately. Diabetes mellitus is a metabolic disorder that affects how your body handles glucose, which is your main source of energy. The pancreas has two main functional parts: the exocrine part for digestive enzyme secretion and the endocrine pancreas for hormones. But we are focusing on the endocrine part called islets of Langerhans. They produce several important hormones involved in blood glucose regulation. Hormones like glucagon, insulin, somatostatin, pancreatic peptides, and ghrelin. In a healthy person, the pancreatic beta cells produce insulin, which is the hormone that allows glucose to enter your cells to fuel your muscles, organs, and brain. But in diabetes, the process is altered. Either the body cannot produce enough insulin or the cells are unresponsive to it. This causes glucose to build up in the bloodstream, which can silently damage the eyes, nerves, kidney, heart, and blood vessels over time. Think of glucose as a fuel for your body, while insulin is the key that unlocks the door so glucose can enter the cells where it needs to fuel. And without that key, or if the door is jammed, glucose piles up in the bloodstream like cars stuck in traffic, and the body's engine starts to fail. Okay? Now for type 1 diabetes, it is an autoimmune disorder. It occurs when the immune system mistakenly attacks the insulin-producing beta cells in the pancreas. This means the pancreas can no longer produce insulin, and without insulin, glucose cannot enter your cells, leaving your blood sugar dangerously high. Type 1 diabetes often develops suddenly. It usually occurs in children or young adults, hence its name, juvenile diabetes mellitus. Some of the early warning signs for type 1 diabetes include extreme thirst and frequent urination, rapid weight loss despite normal eating, fatigue that doesn't improve with rest, and blood vision. Because their pancreas cannot produce insulin, people with type 1 diabetes require lifelong insulin therapy. Diet and exercise alone cannot replace insulin in type 1. Without proper treatment, type 1 diabetes mellitus can lead to life-threatening complications, including diabetic ketoacidosis, which is why early recognition is critical. In type 2, the body is still producing insulin, but the cells become resistant and unresponsive to its effects. Over time, the pancreas struggles to keep up and glucose begins to build up in the blood. Now, type 2 diabetes develops gradually, often in adulthood, though there are increasing numbers of young people nowadays that are affected due to lifestyle changes. Risk factors include obesity, sedentary lifestyle, poor diet, family history of diabetes, and aging. Many people with type 2 diabetes don't even know they have it yet. Symptoms can be subtle at first, but they include excessive thirst, frequent urination, fatigue, slow wound healing, and increased hunger or polyphagia. Unlike type 1, type 2 can sometimes be managed initially with diet, exercise, and lifestyle changes, although insulin may be eventually required. Think of type 2 diabetes as a slow leak in a car engine. The damage accumulates over the years, often unnoticed until complications arise. Key differences between type 1 and type 2 diabetes are the cause. First, I said the type 1 is an autoimmune disorder, while type 2 is mainly insulin resistance as a result of unresponsive cells. In terms of onset, type 1 develops quickly, often in childhood to young adulthood, but type 2 develops slowly and often in adulthood. In terms of insulin therapy, type 1 requires insulin immediately, while type 2 may start with lifestyle changes and maybe if there's no improvement would require insulin therapy. Type 1 symptoms appears suddenly, while type 2 symptoms are often subtle and accumulate. For the risk factors, type 1 is less influenced by lifestyle, while type 2 is strongly linked to weight diet, and activity levels. Sometimes a young adult may think they have type 2 because of age, but sudden onset symptoms like rapid weight loss are classic type 1 signs. Uncontrolled diabetes mellitus can damage the eyes, causing diabetic retinopathy, nerve damage, damaged kidneys, heart, and blood vessels. Early recognition of symptoms, proper testing, and accurate diagnosis allows for timely treatment, which can dramatically reduce the risk of these complications. Quickly before we go, for symptoms, the classics are often called the 3 polys. First, polyuria, frequent urination. When blood sugar becomes very high, the kidneys try to remove this excess glucose through urine. Glucose pulls water along with it, causing the body to produce large amounts of urine. People may notice that they urinate more frequently than usual, including waking up multiple times at night to urinate. The second poly is polydipsia, and this is excessive thirst. It happens because so much fluid is lost during frequent urination. The body becomes dehydrated, triggering intense thirst, and the person may feel the need to drink water constantly. Third poly is polyphagia. Even though there is plenty of glucose in the bloodstream, the body cells cannot access it properly due to insufficient or ineffective insulin. As a result, the body thinks it's starving and sends signal to the brain to trigger the urge to eat more. Other common signs include fatigue or unusual tiredness, blurred vision, slow healing of wounds or cuts, frequent infections, and unexplained weight changes. Listen attentively. In type 1 diabetes, right, weight loss can occur rapidly because the body begins to break down fats and muscle for energy. While in type 2 diabetes, weight gain is more commonly associated with insulin resistance, although weight loss can also occur in advanced stages. Another symptom is numbness or tingling in the hands and feet, dry mouth, dry skin, and fruity smell due to severe dehydration. And in severe cases, ketone builds up, causing diabetes ketoacidosis. Types 1 and 2 diabetes may share similarities, but they are fundamentally different in cause, progression, and treatment. Knowing these differences empowers you to take action, seek proper medical care, and protect your health. If you or someone you know is experiencing frequent thirst, urination, fatigue, or unexplained weight changes, don't wait. Check your blood sugar and speak to your healthcare provider immediately. Remember, diabetes can be managed effectively when caught early. If this video helped you understand the real differences between types 1 and 2 diabetes and you gained something, subscribe to my channel and share it with someone who needs to know. Tap the notification bell sign to know when I post more medically accurate and life-saving health education. Bye for now, and I'll see you in the next video.